In the time it takes to finish this video, someone will have died from opioid overdose. Each day, more than 130 Americans die from opioid overdose, and overdose is now the leading cause of death in the United States for people under 50 years old. Nowhere has been hit harder by the opioid abuse epidemic than the Midwest, where heroin-related overdose deaths have increased by more than 5 times this decade alone. In fact, 1 in 5 opioid overdose deaths occur in the industrial Midwest states, like Ohio, Kentucky, and Indiana. I'm Dr. Richard Meyer, and right now we're at New Foundation's Recovery Housing to highlight how our SAM Foundation is confronting the opioid abuse crisis by helping people overcome their struggle with addiction. We met with the nonprofit's founder to learn more.
Our SAM Foundation started off as going to be a recovery and sober living scholarship fund, and we quickly realized that recovery was pretty much covered through insurance, but sober living had no external source to get help if you needed funds to get into it. The initial fee to get into sober living to someone that is coming out of crisis, rehab, jail, who has burnt the bridges with their family and they no longer have resources, is unattainable. And that's where we come in. In just a little over a year, we have given scholarships to 150 people in the amount of $21,370. We are a hand up. All we want to do is get them in the door of sober living and let them help themselves. That is exactly what we do.
For Katie, this mission is personal. In 2017, she lost her son, Sam, to a fentanyl-laced heroin overdose. He was only 24 years old. His sister, Kayla, shares his story.
Samuel was my younger brother. He was a kind and funny person with an incredibly amazing, sarcastic sense of humor. It's surreal how it all started because he had struggled with mental health for so long, and in learning that he had started using heroin, none of us could really believe it at first. I always described it as, like screaming at a brick wall. There was more than one time where I would be on the phone with him screaming, like, I just want you to be okay. I need my baby brother. We got him in and out of treatment, trying something a little bit different every time. It's like, okay, let's change places, change people, change the situation. I remember at the time that he had passed away, I had like 5 missed calls from my dad, and I called him. He immediately picked up and I just said, what's going on? And he said, Samuel overdosed again. He didn't make it.
Like Sam, about 10% of patients legally prescribed painkillers develop abuse disorder, and 5% transition to heroin once their prescription runs out. In fact, more than 80% of heroin users first misused prescription opioids. One such patient is Nicholas Marcus, who received a scholarship from our SAM Foundation to assist in his recovery.
39-year-old, married, 4 kids, recovering addict, been using some sort of substance since the age of 12. Had a 9-year point in my life where I didn't use heroin, and I had a surgery. They gave me a prescription for Percocet. I abused those, and it took me right back to heroin. And one thing after another led me to homelessness for the last 3-4 years. I found my treatment place. Peer counselor there told me about our SAM Foundation and led me down the road to get into my sober living house where I'm at now. And I just celebrated 30 days yesterday. Been through treatment a few different times throughout my life, taking it serious this time, just trying to get myself back so I can get my family back.
Like Nicholas, the struggle with addiction frequently leads to homelessness. More than half of homeless individuals are dependent on alcohol or other harmful substances. But with access to support, guidance, and accountability, these people can find hope in recovery housing. New Foundation's Executive Director MIKELLA shares more.
Our mission is to provide safe, affordable housing for those suffering with substance use disorder. We provide a recovery environment in which we provide structure, accountability, responsibility, as well as the brotherhood or sisterhood of people in recovery coming together. We take anybody that suffers with substance use disorder, anything from alcohol to heroin, fentanyl, crystal meth, the whole gamut. As long as somebody is admitting that they have a substance use disorder, then we will accept them into our homes. With New Foundations, the program participants are self-funded. Our SAM is our #1 contributor to help people get into recovery housing and helping them with a couple weeks of program fees so that they are able to get on their feet and they're able to look for a job and they don't feel so much pressure. That's why our relationship with our SAM is critical, because we literally can ask for a donation for somebody and she says yes, and we allow them in right away. And so that's kind of the beauty of our relationship, is saving lives together.
Our SAM Foundation awards scholarships through a network of recovery housing organizations. There, participants receive safe housing, access to evidence-based recovery groups, and a systematic approach to sober living. One scholarship recipient, Preston Denny, says our SAM Foundation gave him the hand up to help change his life.
Our SAM Foundation has benefited me in my recovery by providing the money to get me in the door. It wasn't a handout, it was a helping hand. I had nowhere else at that point. My resources had ran dry. I had burned many bridges, and many people pushed me away because they've been dealing with my addiction my whole life. I remember the first time I ever used drugs was 9 years old. It took away temporarily, always being self-conscious of what people thought of me. When I was high, I didn't care what anybody thought of me. I knew that feeling is how I wanted to feel always. I didn't ever want to feel sober. I tried heroin for the first time at the age of 21. I isolated myself from family, from friends who wanted to help me. I didn't want help at the time because what they were offering I didn't see as help. The only help that I knew was the drugs. I self-medicated. I went to prison a year later at the age of 22 for drug trafficking and heroin. Been in prison 4 times. When I lost that crutch of my family, always picking up the pieces whenever I was like a tornado and wrecked everything, I lost that ability to be able to go back home and having help pick up the pieces. I was forced into the streets, homeless. I was at a point in my life where I was hopeless. Reached out for help and called some sober living houses. I didn't have the money to get into sober living, but I knew I needed to be in sober living because if I went back to the same people, places, and things, doing the same stupid things, I was going to get the same stupid results. Our SAM Fund was willing to help me, and I'm thankful for that. It saved my life.
Opioid abuse is an urgent crisis, here in Cincinnati and across the United States, as addiction can destroy families and literally end lives. But you can get involved right now by going to OurSamFoundation.org and learning how you can change and save lives by getting involved with this mission.